All right, everybody, welcome. My name is Amelia Curtis, and I am the Education and Training Manager at San Diego Humane Society. I oversee all of our on-site opportunities for youth and adults, as well as virtual opportunities and our internal training for staff. And you are attending one of our pet talks, which is a lecture series, which discusses topics related to pets. And we are honored this evening to have Geraldine with us, and she's going to be leading us through a wonderful lecture. So before we get started, I always like to share a little bit about some things going on at San Diego Humane Society and promote some animals in our care. So I'm going to go ahead and share my screen. All right, so first, if you're ever interested in just kind of a quick glance at what's going on at San Diego Humane Society, you can just type into your browser sdhumane.org/events, and you can get a snapshot of some things going on. So when you scroll down here, you'll see community and educational events, and that's where all of our programming will be. We have a fantastic pet talk coming up. We're going to be hosting on December 16th. HSUS, which is Humane Society of the United States, and they will be discussing how to shop cruelty-free. They'll probably mostly be focusing on cosmetics, but they will also talk about other things that you can purchase that would not affect animals, and how to make sure that you are reading labels correctly and shopping cruelty-free. So I will send the link to that in my follow-up email with everybody. And then I also always like to share an animal, and I just couldn't get over the cuteness of this cat's name, Black Fluffers. She's 2 years old. It sounds like she is a little bit shy, but she does know how gorgeous she is, and apparently she sits front and center at the window so that she can make sure she gets noticed by everybody, and she's so beautiful. So this page here is a really easy one to share, since it has kind of a snapshot of who she is, and it is also printer friendly if you ever want to help us promote animals, all of our animals in our featured pets section here. We'll have those types of pages that you can share out in the community within your neighborhood or with friends and family. So I'm going to go ahead and stop sharing my screen so we can get started with the presentation this evening. Just a little bit of housekeeping. You can have your cameras on or off. That is optional. It's up to you. And then for questions, you can unmute yourself to ask, or you are welcome to use the chat to ask your questions. Geraldine will prompt you for questions, but if you have a question that you don't want to lose and want to get written down, you're welcome to pop that in the chat, and I can go ahead and ask any questions in the chat for you. So I'm going to go ahead and have Geraldine take it away. Thank you so much for being here with us this evening.
Thanks, Amelia, and thanks everyone for being here today. I'm going to try and share my screen to see if it works. Can you see it, Amelia?
Yes, and I'm seeing your notes too, so I don't know if you want it in a different presentation mode.
Okay, I'm just going to stop it there then. This here. Let's try this. Okay, I think this is going to work.
That looks great.
Okay, perfect. So yeah, now that you've seen my notes, good evening, everyone. And thank you for joining me today. I truly appreciate all of you making time this evening to just learn about the great work that San Diego Humane Society is doing in the community to help people keep their pets. We have a lot of innovative community-based programs, and we're happy to talk about those today. So my name is Geraldine De Silva, and I am the Director of Community Veterinary Services here at San Diego Humane Society. So I thought I'd start a little bit about my background, just to give you some context. I moved to the US about 20 years ago, and these are just some images from India where I grew up. This one here is my family with a pack of dogs around when we just got out of a restaurant, and the dogs sometimes just live on scraps of leftovers. So we were just feeding them some of that. And, growing up in India, there were all kinds of animals outside of my home on the streets, like elephants, camels, horses, and lots of stray dogs. And this little blurry image here is of a monkey that actually was a frequent visitor to my parents' home in New Delhi. And he was known to come and help himself to fruits on the dining table, or if he wasn't satisfied, even go to the refrigerator in the kitchen. So those were some of our regular sights and experiences in India, but there were also some pretty traumatic memories that I have growing up, including dogs that were constantly dying on the street or run over by cars. There were dog catchers that would come and take hordes of dogs and dump them into these huge trucks to euthanize them. And I tried my best, my 8-year-old self, to rescue these dogs because they trusted me because I fed them. But from there, I went on to do my first degree in sociology, where it was a really eye-opening experience because I lived in the very remote villages of India where I lived with people living in systemic poverty. They were experiencing gender discrimination. There was the caste system, as well as female infanticide. So that really stuck with me and taught me also a lot of humility in poverty. And from there, I moved to Scotland, which was my first time out of India. And again, like I went there to do my MBA, but what really struck me was that there was homelessness and poverty in a developed country. And so I started volunteering from there with people experiencing homelessness, even though I was a research consultant at the time. And then I moved to the US and joined an organization called PAUSE, which had a fantastic mission to help vulnerable people, including people with HIV and AIDS, keep their pets. We were initially a volunteer-run organization. Eventually, I was running the organization and we merged with San Diego Humane Society, and the rest is history. So today, I'm really excited to share the great work that San Diego Humane Society is doing. And I feel really fortunate to be a part of this organization that's creating innovative services to help both people and animals in the community. And now in my new role as the Director of Community Veterinary Services, I get to create a whole new department and a whole new team and lay the foundation for growth for this new program. So just some facts that I wanted to share. Often at San Diego Humane Society, we are the only resource and very often the last resource for help for many families. And many people in the community don't even know that we exist or that we are a safety net for their families. So one of my colleagues, Stacey Hurley, who is part of the community engagement team, goes out into schools and speaks to children about animal welfare and the impact of San Diego Humane Society services. And she once asked the children a couple of questions. And the first one was, how many people have pets at home? And almost all the children raised their hands. And so her second question was, how many people have visited or heard of an animal shelter? And not one child raised their hand. So we found that in underserved communities, there are a large number of people who've never heard of an animal shelter and never even visited a vet, even though they have pets in the home. And they live in what we call resource deserts, where the nearest vet or pet store might be miles away. So transportation is often a barrier. So when we as a team and an organization take community veterinary services directly to these underserved communities and serve them where they are, we are removing a number of barriers, including the barrier to transportation. So there's a huge need for access to care. And I wanted to share some perspective and interesting numbers to indicate that need and the need for vet care in San Diego. But first, I just wanted to share that we have a phenomenal Chief Medical Officer, Dr. Zara Hedge, at the helm, who oversees the entire medical department at San Diego Humane Society. And I'm really excited to be working with her. We've also hired a whole new team, including a supervisor for community veterinary services, Jasmine, and 2 community veterinary services specialists, Erica and Ali. And they are from outside the animal welfare field. So we're continuing to expand our team to add on a medical team, hopefully early next year, to focus on community outreach. So please stay tuned in the coming months. So some numbers. More than 45,000 San Diegans live below the federal poverty line. And of these individuals, 54% of them are female and 46% are male. So we estimate that there are approximately 500,000 dogs in San Diego County, and varying by family size, the federal poverty line doesn't take into consideration transportation and housing costs, which are some of the largest expenses for lower income families in the San Diego region. Being poor in a poor neighborhood imposes additional risks and barriers. So in addition to all of this financial insecurity that people face, residing in higher poverty communities is also correlated with a higher incidence of chronic disease like diabetes, heart disease, depression, and asthma. There are also fewer employment opportunities in the area, which contribute to unemployment, and they require people to spend money on transportation to reach their work site, which is in other far areas of the county. So getting back to numbers, kudos to our resource center team who fields hundreds of calls every day. We get over 300 calls for help just for community veterinary services each month. And that's almost 4,000 calls per year. We receive almost 7,000 calls annually just for vaccinations, so preventative care. In addition, we calculated over 4,000 requests for help with spay and neuter each year. We also get close to 1,000 requests for microchipping. That's not as significant as it appears. However, people in the community are still learning about the benefits of a microchip, what a microchip is, and the benefits it has in a quicker reunification with lost pets and their families. We get about 3,700 calls per year from people who are needing non-preventative care for their pets. And lastly, we receive over 1,000 calls for pet food each year. I just wanted to pause for a minute to let you take that in and see if you have any questions before I move on.
Hi, Geraldine. This is Judy Covey.
Hi, Judy.
Hi. I'm not surprised. I mean, at these numbers, have you, now that we've started a program where we're microchipping for free in a lot of these communities, are you noticing an increase in calls? Because I know we're trying to educate people when we're there. I know it's still fairly recent and fairly new, but I was just wondering if we're having an impact in that way.
We're certainly having an impact, and the best way for the community to know more about what we do is word of mouth. So our community engagement team is out microchipping with pop-up microchipping clinics all the time, and people come to them and ask them questions. So we found that people first thought that, for instance, a microchip was a GPS tracking system for humans. And now they're recognizing and realizing that if their pet's lost, they can get reunified faster. So we are getting calls from people. We found that our lost and found team, our reunification team here, is able to reunite these people faster because people now understand that benefit. But we're hoping that as we get more microchip animals out in the community, we won't have as much of an issue with animals being lost and needing to get reunified. Does that answer your question?
Yes, it does. I volunteer at the microchip clinic, so I just want to make sure we're getting the word out like we're trying to do. So I just, and of course, anything you can help with those of us that, volunteer out there so that we know we are getting what we should, more, if there's more that we could be telling the people.
Absolutely, yes.
And updating our handouts would be really good.
Absolutely, absolutely. And first of all, Judy, thank you for volunteering. And, the impact for these kinds of services cannot be seen immediately because it does take time, but it's certainly spreading in terms of a positive impact. And I can see that, it's about sharing information more than educating the community, because these conversations lead to other further conversations where we can provide resources. So certainly your work is going a long way, more than you can imagine. So thank you.
Hi, Geraldine. This is Melina.
Hi, Melina.
Hi. So I work for SNAP, the Spay Neuter Action Project.
Yes.
And I'm always making sure, because I'm a scheduler and sometimes I work on at the bus, but mainly a scheduler. And right now we primarily focus just on the North County, but we get tons of calls from like Central San Diego, for microchips and vaccines. So I'm always making sure that I'm up to date on like the resources for the San Diego Humane Society and letting them know, and then emailing them the information.
Fabulous. Thank you for doing that. And I'm so happy you're here because we've partnered with SNAP so many times. And in fact,
yes.
Part of our presentation going forward, I've got a shout out to SNAP actually. So yeah, thanks for sharing the information. Please keep doing that. And we always have updates on our website in case you have like hard copies. You always want to check the website for updates so you have the most current information.
Yes, thank you.
Thank you. Okay. So talking about access to care, because it seems to be the new buzz term, and it's also so relevant though, because when you dive deeper into it, you can literally like join the dots, like with systemic poverty, resource deserts, sick or injured animals, broken fences, stray or loose animals, homelessness, unemployment, increasing fees and fines, discrimination and inequity, biases and judgment, hungry people and hungry animals, need for healthcare for humans, and need for vet care for animals. So not to forget what can not be physically seen, like mental illness and trauma. And there's also trauma in animals. So although the list goes on, the one common factor we found is the animal in each family. And no matter what the circumstance, whether old age, life-threatening illness, mental or emotional trauma, we've seen firsthand that people put their pets first, and that is why we love what we do. So we believe that helping people by helping people, we can help the animals that they so love. So last year, we added inclusion to our list of core values here at San Diego Humane Society. And it's a huge testament to the dedication to make a change. So thank you to our president and CEO, Dr. Gary Weitzman, for steering our organization in this direction, because he has a big vision for San Diego Humane Society, including community veterinary services, so everyone can have access to care. So I'd like to share with you what this covers. So community support services is more than just veterinary care. To give you some context, community veterinary services is one of those innovative ideas where we've pivoted as an organization, especially in the last 1 year. So through the COVID pandemic, we modified the way we provided services to the community to make it more community-based and community-focused. And we recognized that there is an immediate need to do this as the next course through the pandemic. So it gives some context to our launch of community veterinary services and how it fits into the larger picture. So as you can see, San Diego Humane Society is a large safety net, providing interventions and services throughout San Diego County and now even beyond. And all of our community support services programs work in tandem with each other, and we lean on each other to fit under this broad umbrella. So it's a very collaborative effort, both internally as well as externally outside of the organization. So for instance, like our community engagement team's efforts includes kids camps on sites, as well as humane education in schools, like I mentioned, spreading compassion and to prepare the next generation even for animal care and animal welfare. The team also operates a large community pet pantry where we distributed over 2.5 million meals through the pandemic. And then they also launched very recently an emergency foster program. So people in a crisis, whether it's a healthcare crisis, a domestic violence situation, housing or employment related, they do not have to face any additional trauma of having to give up their pet. And then we have the behavior team that provides support with training interventions. We also have our humane law officers, and they share resources and support out in the field. And then, like I mentioned, like our resource center fields hundreds of calls for help every day. So when these families run out of options, we have the community veterinary services team as a safety net on hand. So we ensure that we pull together all the interventions and help each unique family so that they can keep their pet. And often the need for vet care, like I said, is their last resort before they consider relinquishment. So we recognize truly that, you know, when people are in distress or desperately reaching out, many are asking for help for the very first time, and it's so hard. So we make every effort to be inclusive, and we treat them with dignity and compassion and meet them where they are at that moment in their life. So I'd like to share a favorite little video of a sweet family that stole the hearts of our team. And we've watched this video like over and over again, but I'd like you to meet Joseph and Olive Oil.
Oh, Dad. Oh, is that your daddy? Oh, you're missing him. Oh. I think she's happy.
Oh, and I'm not happy. I'm not happy. Told you they're coming back. I know, I told you.
My favorite. So as you can see so clearly, Joseph and Olive Oil were inseparable, and she was really his reason for living. He literally left the hospital with his IV tubes still attached to his arm because he wanted to see his beloved Olive Oil. And he told us when he came to collect her and be reunited that the doctors at the emergency told him if he hadn't shown up there when he did, he wouldn't be alive today. So our team saved his life too. You know, and that is why we offer all of these creative solutions and interventions. And, you know, I'd just like to share a little bit more about our growing community veterinary services. So our vaccine and microchipping clinics are under the preventative care umbrella at San Diego Humane Society. So we offer various vaccines for dogs and cats at 4 of our campuses. So these low-cost clinics are open to the public to access at San Diego, El Cajon, Oceanside, and Escondido. So we provide various vaccines for dogs. So distemper, for instance, affects the respiratory and nervous systems, and it can often be fatal. And then there's hepatitis, which can lead to acute or chronic liver inflammation. Then there's the parvovirus, which can cause severe diarrhea, vomiting, and dehydration. It's life-threatening, especially to puppies. And then rabies. This can cause neurological problems and lead to death. We also provide low-cost microchipping and licensing, like Judy was mentioning. And next week, we're going to start offering the canine influenza vaccine. And this is a 2-dose vaccine, which is spread out between like 3 to 4 weeks in between the 2 doses. And this disease is spreading in LA and can cause a respiratory infection for dogs that are exposed to other dogs outside the home. So we also offer the FVRCP vaccine for cats, and this prevents infectious respiratory disease and lifelong infections. So we have, like I mentioned, a team of CVS, that's Community Veterinary Services specialists, who are on hand to help with special cases. So for instance, if a guest comes to the vaccine or microchipping clinic and they indicate or we sense that they're in need of more help, we try to support them with whatever is appropriate, whether it's a referral or helping navigate various resources. So it's very much a case management approach to make sure that the referral is carried forward to get them the resources that they need. We recently held a rabbit vaccine clinic, which was fun with all the little bunnies. We collaborated with the House Rabbit Society, and our amazing medical and community veterinary services team saw 50 rabbits in a span of 2 hours, and we got them vaccinated and groomed. And this vaccine is administered to prevent rabbit hemorrhagic disease. So in addition to these on-site clinics, our community engagement team, like Judy was saying, holds these microchipping clinics in the field. And we are hoping in the future to partner with community agencies, like even like fire stations and libraries, so that they can have microchip scanners at their facilities and work as microchipping scanning sites, so that animals can get reunited with their families faster out in the field instead of coming into the shelter. So our community spay and neuter program is one that we've had for a while, and it is an attempt to reduce the increasing population of homeless animals around the county. So we've reopened this program now because it was temporarily closed on hold during the pandemic. This is essentially a low-cost program where we've removed the barriers of breed restrictions and targeted zip codes. And we're trying to make it accessible for the community so that, by providing the service, we can get their pets the help that they need. So it's really any member of the public can utilize this service. And we also offer a discount to the military. And if needed, we will waive the fees for people who are in extra need of help. So our voucher program offers a host of options. And as I mentioned earlier, our community veterinary services specialists focus on specifically navigating resources for people in a crisis. So say if they're in need of veterinary assistance, for instance, we have further options. We've created a huge network of over 100 vet offices all over the county. And it's very collaborative with these clinics and hospitals because they're trusted partners that work with our referrals and our requests for help. And together we are able to provide necessary interventions. So through this voucher program for veterinary care, we provide support for preventative as well as urgent care. So if it's life-threatening, of course, like, it's a higher cost, and there are other organizations that they can go to that we refer them onwards to. And if there is additional funding that's required, our specialists will advocate for our guests, and we even pool in resources with other funding agencies to meet the funding needs that each family requires to get their pet seen by a vet. And some of these cases can actually take days to navigate, because the guest might not have a phone, or they might not have access to an internet, or they might not have gas in their car to get to our office to speak to our specialists. They have so many barriers. There are also some animal welfare agencies that have a specific area of focus, like they'll help with certain breeds of dogs or senior dogs, or with people experiencing homelessness. So we kind of try to target our resource navigation and advocacy for these families to those agencies to sort of jump the line a little bit, so to speak. And our voucher program also includes spay and neuter services. So guests that need to spay or neuter their dogs can actually utilize this voucher program and work with any one of our vet partners to have their pet altered. This has been hugely successful. When we launched it last year, we were inundated with requests. So in a way, it's actually really encouraging, because our community recognizes the need to spay and neuter and reduce the population of homeless animals. And then we realized we could introduce transportation vouchers, because that was another barrier. And so last year we soft launched and then piloted a transportation voucher program in partnership with Uber. And this was in response to remove this recurring barrier, where people just needed to get their pet to a vet. And then soon we recognized and realized we could expand this even further. So we've even used this voucher program to bring adopted dogs to the homes of their disabled new family who couldn't find transportation to come and pick them up when they were adopted. And then we've also used it to bring youth from underserved communities to attend our kids camp. So, the possibilities are endless if you use creative solutions.
Is that still a pilot program?
It's not a pilot program anymore, because it's just, evolved organically, where our organization has just kind of embraced it. And so our adoption team, our community engagement team, and everyone that really needs it, as soon as they hear of a request, they utilize it. And the training is really easy. Uber has been fantastic and a great partner to work with.
Oh, that's amazing. Thank you.
Yeah, you're welcome. So last year, we launched another program which we call Mobile Mondays, and it is a mobile outreach service. So because we're close to the public on Mondays, we decided to utilize that day to go out into the community, and we utilize our medical team here to go out with us in our huge mobile unit, and we provide preventative care. So we have wellness checks, we provide flea and tick preventative, we even do nail trims, and then there's ears, eyes, and skin checks that we do. We provide microchipping, we provide a host of pet supplies as always, including pet food, and our behavior team is always on hand to provide training tips. So, again, if people need vouchers or further assistance, we're able to provide them with that as well. And we found, again, everyone's story was different. Excuse me. When speaking to people, we found, like with one gentleman, for instance, he had lost hope because he had lost his spouse, and then he was depressed and alone at home. And this led to him losing his job, and then subsequently losing his home, and then he became homeless. So all he had left was his dog. And so for us, providing vet care for his dog, which was really his only reason for waking up each morning, was life-changing. So, we cannot underestimate the work that we do, and we keep reminding ourselves that we have to recognize each person's story. Sorry, I'm just taking a little sip of water. So getting back to this, we've piggybacked in the past on various events, large scale and small scale events, including resource fairs, where we've helped homeless veterans in need. So they could get the healthcare that they needed for themselves, but they would have avoided that had we not helped their pets. Excuse me. So we've been at these resource fairs providing vet care as well as pet sitting and boarding, and people were able to access resources for themselves. So we've partnered with SNAP, like Melina mentioned, and they've provided spay and neuter surgeries out in the field, on site in underserved communities, which was pretty significant and amazing. Excuse me. So maybe this might be a good chance to see if there are any questions so that I can catch my breath.
You can unmute or pop any questions in the chat.
Hi, my name is Kelly Bremkin. I'm actually in the Portland, Oregon area. I'm the veterinary social worker at Oregon Humane, and our community hospital doesn't open until the summer. So this has been such great information. I do have a question on the slide where you were talking about the needs. Can you tell me how you track those needs or those incoming calls to show the demand for the program?
Okay, let's see how my voice does. So these needs are tracked in a pretty detailed way. We've got an extensive resource center team, and every call is tracked. So we track it from the time that the calls come in, and once the call is completed, we track the reason for the call, and we kind of specify whether it was for vet care, whether it was for spay neuter, or whether it was for vaccinations. So this way, we can actually target our services based on the need. And we found, for instance, that the number of calls for spay neuter were related to the word that was going out in the community through our community engagement team, as well as through people visiting the website. So we then had to pause having this button on our website so that people we could actually manage the number of requests. So, again, it's really impactful because we can see that the more we share information, whether it's in schools, because children share a lot of information with their families, whether it's our humane law officers sharing information with the people that they meet out in the field, or even our volunteers meeting people who come in for maybe adopt a dog. We kind of try to take into consideration all these requests, but primarily these numbers that I have here, which is stated under the need, comes into us from our resource center.
Thank you.
You're welcome.
And Geraldine, there was a question in the chat. How do you determine who qualifies for the mobile outreach services?
So for our mobile outreach services, what we found is before we used to actually, have a barrier, which was we expected people to give us some kind of qualifying document. So it could be a financial document to show their income level or like what their total household income was. But what we found was that when we go into safe parking lots or to places where we partner with agencies who are already serving people who are needing human food or access to a laundry to wash their clothes, they're already needing resources. So with that, we recognize that if we partner with agencies who are already providing it to people who are underserved or lacking resources, we don't, one, need them to tell their story again, and we do not need any kind of qualifying documents because they're already there to get help for themselves. Okay. So at these mobile outreach events, at Mobile Mondays, we provide, like I said, like a host of services that I mentioned above. And we found from various statistics that there are approximately 9,000 people experiencing homelessness in San Diego on a single night, with nearly 5,000 of them living unsheltered. So they might be on the streets, in vehicles, in canyons, or in other places that are really like not meant for human habitation, really. And the regional task force on the homeless, and we are members of the regional task force on the homeless, which is really, really eye-opening because we get to see so much and hear so much of what happens behind the scenes. So they estimate that the number of people experiencing homelessness for the first time last year nearly doubled to 4,100 in 2020. So we recently held a Mobile Mondays clinic at the Neil Good Day Center, which is a great resource for people who are experiencing homelessness. And it basically serves as a point of entry to a variety of homeless services in San Diego. They provide homeless individuals with access to mail services, a laundry facility, showers, and even a safe environment away from the city streets, during the day. They even just like sleep there right on the lawn so that they can just get a little bit of peace from all of the chaos in their lives. So we brought our mobile unit to the center and were able to serve all these families experiencing homelessness with their pets. And we ensured that they were vaccinated and received all these additional resources, including flea and tick medication and pet tags to keep their pets healthy and safe. So we hope to strategically expand our services with human service groups in 2022. So our mid to long-term plan in community veterinary services is to have a stationary clinic. We're aware that diagnostics and a simple vet visit can be so costly, even for us, And so we'd like to set up a stationary clinic that provides sick care and not just preventative services, like what our vouchers provide and our vaccine clinics. So we envision it following like a One Health model, which I'm going to talk about, that where eventually we'll have caseworkers and resource navigators for the whole family in one place. So this is not really intended to replace like our other outreach efforts, but it'll complement what we're already doing out in the community. And, like in instances where a referral could get lost in the mix, we still have another layer in the safety net. So I'd like to touch on the topic of One Health and its significance in the work that we're doing. And, like the CDC, quoting the CDC, says that One Health is an approach that recognizes that the health of people is so closely connected to the health of animals and our shared environment. It relates to two related ideas. One, that the concept of humans, animals, and the world that we all live in are all linked. And second, it refers to the collaborative effort of many disciplines that are working locally, nationally, and at the global level to obtain optimal health for people, animals, and the environment. So really, when we consider animal shelters in this whole One Health framework, the health of animals is connected to the health of people and our environment. So in other words, if we want to address the root causes that lead to animal welfare issues, we need to connect to and collaborate with organizations outside of the animal welfare world. So one of our very own veterinarians at San Diego Humane Society, Dr. Laura Bunke, is very passionate about One Health, as is a host of our other vets like Dr. Chapman and Dr. Sarvis. So Dr. Bunke recently shared some very interesting information in a presentation that she made, and I've kind of borrowed from that so I could share it today. And in 2021, a survey estimated that 70% of US households own a pet. So that's 90.5 million homes with pets. And I think it's safe to assume that this does not include people experiencing homelessness with pets. So that would be about 45 million households with cats and about 69 million households with dogs. That's a lot. And there are about 200 known zoonotic diseases, also called zoonosis. And this is a disease that's carried by and transmitted from animals to humans. So 3 out of 4 new infectious diseases in people are acquired from animals. And 6 out of every 10 infectious disease in people are zoonotic in origin. So just to list some infections, like bacterial infections could be like tuberculosis, salmonella, anthrax, and there are many more. And then parasites could be like giardia, hookworms, tapeworms, and toxoplasma. And cats are the only species that can transmit toxoplasma, although that there are like other mammals and birds that can, also get infected. And this can be through contamination or undercooked food. And this is also a leading cause of death in the United States. There are also fungal infections like ringworm. If you're walking barefoot on the beach, at Dog Beach, I've known people to get ringworm. Viral infections like rabies, Ebola, and influenza. Domestic dogs are known to be the main carrier, as we know, and source for human exposure to rabies. So globally, approximately 60,000 people die from rabies every year. And 99% of those cases are from domestic dog bites. So bats, skunks, raccoons, foxes, and coyotes are also carriers of rabies, although any mammal can be infected by this disease, by this virus. So although the US is, considered free of dog rabies, like for the last 2 years, there still have been a few reported cases of rabies here in our country. And then we also have foodborne illnesses. So these are diseases or illnesses that are caused by contaminated food. So most commonly, this is caused from bacteria, viruses, or parasites that are present in food. So 1 in 6 people in the US will become sick from a foodborne illness every year. And then there are vector-borne diseases. So these are diseases that are spread by mosquitoes, ticks, and fleas. So Lyme disease, we've heard about it here in the US, is an inflammatory disease that's caused by bacteria and that's transmitted by ticks. So in 2010, 22,500 cases of Lyme disease were reported to the CDC in the US alone. And then there's Ehrlichia or ehrlichiosis. This is a tick-borne disease that's primarily from the brown dog tick, and it's very common in Mexico, and we've seen it here in the US too. And that's why vaccinations for humans and the preventative care vaccines that I talked about for animals, as well as flea and tick medication, is vital to prevent or lessen the spread of serious and fatal disease. So zoonosis and marginalized infectious diseases have a close correlation with areas of concentrated poverty. And poor individuals who are living in these poor neighborhoods face a doubly challenging set of circumstances that ultimately lead to worse health outcomes. So how does community veterinary services and One Health go together? For starters, studies show that among other things, having a companion helps reduce anxiety, lowers blood pressure, increases social interaction, supports people with PTSD, supports the mental health of children, and so much more. So we in community veterinary services have a vital role to play and can make a significant difference on the impact on the lives of these families, the health sector, and the environment. And like I mentioned earlier, when people come to us with whole needs, they are needing comprehensive services. We've learned that they will willingly talk about their pets' needs, and it's a good first step to recognizing how we can address the larger need, including their own health. And so even though these are very difficult conversations, oftentimes we found when we're offering assistance or referrals, we've identified these gaps between human health services and animal welfare. So both sectors have the same families essentially asking for help and are almost always reliving the trauma when they have to tell their story over and over again. So animal shelters can provide preventative care to prevent vector-borne parasite zoonotic diseases that can affect humans. And human healthcare agencies are providing vaccines, preventative care to protect humans. So providing care for humans and animals at the same place removes the barriers and helps keep both human and animal health care a priority. So last year, we piloted a One Health clinic in partnership with Family Healthcare Centers of San Diego. We learned at that clinic that one of the case managers that had a client, she hadn't seen that client for many, many months, but she mentioned this clinic to her client because we were offering vet care for pets. And he showed up at the clinic. So while we were taking care of his cat, she learned that the reason she hadn't seen him for all these months was because his cat was severely ill. And when he heard about our clinic, he brought his cat in to get the help needed. So while his cat was getting care, he was able to be seen by his case manager. Of course, his cat was getting a lot of snuggles as well from our team. This case could have otherwise impacted his stay in long-term housing. And without these joint resources, he could have ended up becoming homeless or living on the street. And then, as you know, the cycle goes on. So our plan is to have a reliable and consistent presence in the community and at human health and resource fairs along case managers and social workers who are serving the same families. And then with human and animal healthcare accessible in one place, we can move closer to the bigger goal of One Health and eventually incorporate resources for environmental health as well. Any questions before I move on to our Baja clinic? Okay, so I'm really excited to share that just this week on Monday, December 6th, we reached another milestone at San Diego Humane Society because we expanded our reach to Baja in Mexico. This was the first time we have expanded our services, beyond the border to our neighbors. And so because of our strategic proximity to our neighbors, we had this opportunity to build a relationship with Tijuana Animal Control and the Baja Spay and Neuter Foundation. So both our teams collaborated to pilot the first Baja Wellness Clinic in the middle of a very underserved neighborhood. So in 4 hours, the Baja Spay and Neuter Foundation was able to complete 50 sterilizations. So they used ironing boards for surgery tables, which was set up just in a large empty room in a healthcare center. And the animals were sedated while they were lying, like literally in the loving arms of their families. And even when they recovered from surgery, they were placed in their families' arms because there was no space to leave them. Some of them were lying on the grass, some of them were lying on the concrete floor. But don't get me wrong, these people loved their animals, and it was really endearing to see them speak to their animals and watch their animals as they recovered from anesthesia. They carried them in tarps, in milk crates that were padded with towels, and in their arms, and even in cardboard diaper boxes. They got whatever they could to keep their animals safe. And like I said, they stayed with their animals every step of the way. And that's something we don't really get to see here, because it's a more sterile environment here in the US. We drop our animals off at the clinic and then we see them when they're fully recovered. So that was really kind of interesting to see.
Geraldine, this is Melina.
Hi.
And that's going to happen every month?
Yes. So we already have our next date. That's set up for the 7th of February. And we're going back into the same area because we just found that there was such a huge need and we didn't want to turn people away. So we're going to do this every month, starting in February, and we've got the date set for February 7th, and then we're going back in March and April, and then hopefully, we'll see how that goes, because we want to be able to address this need in various communities. But if we feel that going back into the same area, if word of mouth spreads, we might just end up doing that. We even found one of our guests who comes to San Diego Humane Society to receive pet food and who's been coming here for many years showed up at the clinic there,
Oh, wow.
So, word spreads further than we even realize.
Do you guys take volunteers for those clinics? So this is like a Christmas present to me. It means so much to me because I grew up in for 5-6 years in Tijuana, Mexico. So like how what you saw in India is basically very similar to how I grew up, and it was very depressing for me. So this means this is great. It means a lot to me. Yeah,
we'd like to sign you up.
Awesome.
At this time, just because, we are learning, I truly feel we are the learners. We're going there to see how we can better serve the community, so we can respond to their needs. So we've got a team of 10. We're going to keep it to the team of 10, which are all staff right now. And as we expand, if we feel that this is something that we want to offer to volunteers, we would absolutely love to engage volunteers and would love to take you on, because, we want to have people who truly understand the community, who can relate. And for sure, our team is very diverse. So, Erica here speaks the language. She's from Tijuana. I just think being representative of the community is very, very important as well. But again, the community is so accepting and welcoming and grateful, and of course, when we don't speak the language, there is a way to communicate around that too. So.
That's amazing. Okay. Thank you.
Yeah. Thanks for your enthusiasm. I hope we can take you with us to Tijuana one day.
Yeah.
And so these are just some more pictures from the clinic. As you can see, I just love these adorable pictures. I took them with my phone. There was this little girl with her little kitten, and I just saw the diaper box and I was like, what's in there? And she opens this box and just pulls out this little kitten, and all these cats and dogs were so comfortable around each other, and we were afraid that they would run away. But the vets from Baja Spay Neuter Foundation said they're all from the community. So even if a cat gets out, it knows how to get home, because, they're indoor-outdoor cats. As you can see here, these are the ironing boards where the surgeries were conducted, and the animals were left just on tables just next to that to recover for a while. People were using belts or any kind of cable looking thing to tie all their dogs together, and people were running back home and bringing more animals. And it was like this whole movement happening, you know, as word was spreading in the community. So we were able, our team, our community veterinary services team was able to provide 99 wellness exams in those 4 hours. We provided 190 vaccines, 75 deworming medications were given out, and we provided over 300 flea and tick preventatives. You know, because of Ehrlichia, we realized we can provide the flea and tick preventative right there and then, but then we need to provide them enough for the next month and the month after that. So yeah, we did that. There were, you know, almost 700 pet supply items that were distributed, and of course, like countless snuggles. You know, we also had people that were asking for birth control. So like coming back to One Health, you know, and having all these services together, you know, it was definitely a sign that we needed to have human services present there too. So hopefully, you know, that's still like our pipe dream. And interestingly, very, very interestingly, not one of those dogs that we examined or provided vaccines to had ever received a DHPP vaccine before, despite the high rate of parvo in Mexico. So our presence and giving out these DHPP vaccines was huge. So of course, this would not have been possible without our teams coming together. And like I said, you know, we're looking to making this a recurring event, along with, like, you know, here we're going to be having One Health clinics in San Diego too.
Geraldine, there's a question in the chat. With your team of 10, how many are licensed veterinarians or RVTs?
So we have 3 licensed vets that we take down, and we had 3 RVTs, and we had 1 VA, and then of course we had like the community veterinary services team, like we were helping set up, and I was taking pictures and talking to the community members, and you know, people doing check-ins and checkouts. Yeah, good question. And so this is Martine and Rocky. Just love them, you know, because I wanted to circle back to my childhood, you know, and when I was 8 years old and rescuing dogs off the street. And here's Martine. He said his name was Martine David Mendes, and he had like, I think 4 to 6 names after that. And we had to tell him to stop, 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 because we didn't have any more space to put him in there. Yeah, and so he brought his beloved dog Rocky with him, and he just showed up there, and we were like, okay, where are your parents? And he really confidently said, I'm here, and this is my dog, and I own this dog. And so we were like, okay. And then we found out that he couldn't write. So our community veterinary services specialists helped him fill out that form for whatever his dog needed. And we found out that his neighbor had given him a ride here because they found out that we were providing resources for pets. And he had just found this dog on the street and made him his own. And so when we asked him, we were like, so what would you like us to provide for your pets? And he was like, anything that Rocky needs, but just don't take my dog away. You know, so that was pretty beautiful. And that was all we needed to hear. And it kind of validated why we do what we do. And it really captures the essence of our work in every way. And so, you know, just winding up here, I'm talking about collaboration, because again, none of the work we do would be possible without a collaborated effort. And so every person, as you could see, every person that we help is struggling, and their pets are, you know, one of the most important stable sources of love, joy, and hope in their lives. And so at San Diego Humane Society, we're all working together to help keep pets with their families. And outside of our organization, we're continuing to build and steward relationships that can support the same goal. And so in order to integrate this One Health approach that I was talking about, each of these partner agencies, whether they are veterinary offices, schools, churches, food banks, you know, community members, even council members or human health service providers, we all need to join hands to provide these creative and innovative solutions, to remove barriers, to provide access to care, and create a healthy community. So, we've chosen to enjoy the ride, and we are having fun growing community veterinary services. This is us coming back from the Baja clinic, and we found out that these are called diablitos. They were super yummy, and I think it's important to have fun while we do what we do. So thanks so much, and I'm going to stop sharing my screen so I can answer questions. Thank you, Jeffrey.
Thank you so much, Geraldine. Does anybody have any more questions? You can unmute or put it in the chat.
Okay, I see something in the chat. Now I can read the chat. Can you talk more about the types of medical services you envision the stationary clinic offering compared to the mobile clinics? Yeah, so like the mobile clinics, like we don't have any x-ray machines, we do not provide any surgeries or anything of the sort. So we're just really like providing wellness checks. We don't do any blood work or anything like that. So with the stationary clinics, we want to be able to provide blood work and diagnostics. We want to be able to provide x-rays and see if we can even provide surgeries on like a mobile unit if we have one, or at the clinic itself. So we can kind of bring everything in one place. We do want to be able to do more dentals, and if there are any serious like skin infections and things like that, which we couldn't otherwise take care of at our mobile clinics. You're welcome. Anything else?
So if there aren't any other questions, or if I'm thinking of one, we'll give you another minute, but you can also always email me when I send my follow-up email, and I can get your questions to Geraldine. I will be including a link to the recording for this lecture this evening, as well as a PDF of the slides so that you can review them afterwards. All right, are there any other questions? All right, well, thank you so much, Geraldine. That was wonderful. And I know we're all proud of our jobs here at San Diego Humane Society, but you must really be proud of your job. You're really doing some special things out in the community, and we are honored to work with you. So thank you all for attending this evening. I will send out all the follow-up information, and I hope everybody has a wonderful evening.
Thank you.
Thank you.